There are several changes to your body that you may anticipate while pregnant, including an expanding belly, bigger breasts, and possibly some swelling hands and feet. Do you realize that your skin can also change? Here are 8 common skin changes that you might go through when pregnant and how to try to avoid, or minimize, them. 1. Stretch marks. Over the course of her 9-month pregnancy, the average woman puts on roughly 13 kilograms. Stretch marks may result because your tummy skin may swell to accommodate your growing baby. Stretch marks, which appear as pinkish or reddish lines running down your abdomen and/or breasts, affect over 90% of pregnant women. Exercise, hydration, and lotions with alpha-hydroxy acids and vitamin E have all been linked to a reduction in stretch marks. There is no scientific evidence that these treatments directly reduce the appearance of stretch marks. The center of a pregnant belly has a darkish vertical line called line nigra. There is nothing you can do to stop this pregnancy line because it is a normal aspect of pregnancy. The good news is that it frequently goes away soon after delivery. 2. Mask of pregnancy. Melasma and chloasma are other terms used to describe the mask of pregnancy. Your face will develop dark, blotchy areas due to melasma. These spots, which are a result of enhanced pigmentation, most frequently show up on your forehead and cheeks. Your body releases more hormones during pregnancy, which results in an increase in pigmentation. After the birth of your child, these skin changes ought to go away. You should always plan to be outside and wear a strong sunscreen with at least SPF 30 to avoid getting the mask of pregnancy. Due to your skin's extreme sensitivity and exposure to the sun, you are more likely to develop these black patches on your face. 3. Acne and pimple breakouts. In the event that you currently suffer from acne, pregnancy may exacerbate your condition. Your oil glands secrete more oil as a result of the additional hormones in your body, which can result in outbreaks. You ought to follow a regular cleaning schedule. Start with a basic face soap that is available over the counter. To prevent nausea, it is a good idea to use fragrance-free soap. To get rid of any leftover oil, use an astringent next. Avoid using any acne-treated astringents since they can contain medication that is unsafe for pregnant women to use. 4. Varicose veins. Bulky, blue veins known as varicose veins typically develop on the legs during pregnancy. This occurs as your body adjusts for the increased blood flow to your unborn child. Unfortunately, you may be more likely to develop varicose veins during pregnancy if you have a family history of them. The good news is that you can do something right away to stop or lessen the symptoms. Point A: don't spend a lot of time standing still. Point B: walk as much as you can to encourage the flow of blood back to your heart. Point C: never sit for extended amounts of time without your feet up on a stool. Point D: wear compression socks. Point E: consume enough vitamin C. This helps keeps your veins healthy and elastic. Point F: spend at least 30 minutes a day sitting with your legs higher than your head. Point G: avoid gaining too much weight. 5. Dry and itchy skin. Your skin tightens and stretches as your tummy expands. Itching and extreme dryness are the results of this. Late in your pregnancy, if you start to suffer extreme itching that is perhaps accompanied by nausea, vomiting, appetite loss, exhaustion, and/or jaundice, you should see a doctor. If your arms and legs are also itching severely, you may have pruritic urticarial papules and plagues, PUP. About 1 in every 150 pregnancies has PUP. After birth, PUP, which are elevated, reddish, itchy patches on the skin, will fade away. Your doctor may recommend oral medications and anti-itch creams to help with PUP. 6. Skin tags. Skin tags are extremely tiny, loose skin growths that typically develop under your arms or near your breasts. You might no longer have skin tags after giving birth. If they don't go away, there are methods to get rid of them. 7. Darkening of moles, freckles, and other skin areas. Your skin's pigmentation changes as a result of elevated hormone levels. Dark pigmented skin lesions including freckles, moles, nipples, areolas, and labia may get darker over time. Nothing you can do can stop this from occurring. You should get in touch with your healthcare professional if a mole or freckle changes in size or shape. After delivery, these darker patches may continue to be darker. Although not radically different, the color might change noticeably. 8. Body hair. Changes in hair growth occur elsewhere outside the scalp. During pregnancy, you could discover that certain undesired and strange spots on your body are sprouting hair. Take solace in the knowledge that this is only temporary and should disappear within about 6 months after giving birth if you notice hair growth on your face, around your nipples, on your abdomen, or on your bottom. However, shaving, waxing, or electrolysis are all entirely safe methods of hair removal during pregnancy.